Hi, my name is Dr. Raja Adnan Ahmed, and I am a consultant psychiatrist working in UK. And with me this morning is Dr. Shawn, who is an IMG from India. And the reason we are doing this interview is about sharing his experience of core surgical training, securing core surgical training, because there's a myth out there among the IMGs that surgery is very impossible to get, and it's very hard. So I just wanted to introduce Shawn. He's a IMG from India who has done his MBBS in 2018, and he came to UK in 2020. And as we know, it was a time of great uncertainty due to COVID and exam cancellation, flight cancellations, visa issues were going on. But he was able to actually not only come here in 2020, but also secure his GMT registration and start as his non-training post in 2020. And now he's able to secure his core surgical training, which I think is a big achievement. So first, Shawn, I like to thank you for doing this and sharing your experience. I think you will be helping a lot of IMGs by doing that.
I'm really glad. Thank you so much for having me.
So I wanted to ask you, the first thing is, can you tell us a bit more about your journey, because it is a very inspiring thing you've done so far.
So basically, my journey started, I would say, in 2019 when I first wrote my PLAB 1 examination in the month of November. And then just as I got my results, me and my friends, we collectively booked the PLAB 2 examination, as every one of us do. And then I came to UK, I think in February, end of February, to get some coaching and stuff. But then the pandemic hit in the month of March and the exam got cancelled, and twice it got postponed. And then we passed the examination. It was quite uncertainty. We didn't even knew what was the pilot test going to be, how it is going to be conducted with minimum number of people in the centers. Are they going to give us more cases, difficult cases, different cases? There was quite a lot of uncertainty. Financially, it was quite a lot of burden on me, to be honest. But then, yeah, somehow, by God's grace, passed my PLAB 2 examination and started my job very quickly. Been working first. I started my working, I think, in Queen's Hospital, Romford, in neuroscience. And I would say it was a wonderful journey over there for a year. And then I wanted to experience how surgery works in NHS. So I moved into St. Thomas's in London itself in trauma and orthopedics. Been a very good experience so far, I would say.
Thank you for sharing your journey. So I think the main question for this video would be people asking your experience of securing core surgical training, because as I said, there is a lot of myths around surgery, or some of the things that people say are true as well, that it is competitive to get into surgery if you're comparing it to GP, IMT, or psychiatry. So what has your experience been to secure core surgical training?
So when I was stuck in the pandemic, the first thing that I did was to make sure that I'm utilizing my time very efficiently, because of course I didn't know when the PLAB 2 examination is going to be conducted. So I downloaded the self-assessment form for surgery. And then I found out that there were quite a lot of things that I already had from my med school. So I would say that was quite a bit of an advantage for me. Because I had quite a lot of things which I did in my med school, and I didn't know that those are supposed to be counted for core surgical training. Apart from that, I started preparing for core surgical training as soon as I joined my job. The first thing was to get the CREST form signed. Although I had a CREST form signed back from home, but I wanted to get a new CREST form signed by one of the UK consultants to know that actually I have achieved quite a bit of it. And then the preparation of audit and research was something which was always in my mind. Although I had one research from back home during my medical school, but it was not yet published. So I did not know whether that would be counted. Neither it was given for assessment purposes. I would say the self-assessment form is something which is very, very important. My journey for core surgical training started as soon as I entered my first job as a non-training doctor. Made sure that I know what contents are available for me to do, how soon I can do them, who is the best person to approach for me, and who would really help me to attain my competencies that I require for surgical training. Although I was in a non-surgical department, but I made sure that I'm doing whatever it is required for a surgical training.
Okay, so I think it's a good point you mentioned, that if you are looking for surgery, even if you are in your home country or you're still a medical student, it's good to actually download that criteria or the scoring system, self-assessment form,
Yeah.
and then actually see how many boxes can you tick, and if you can't tick some of them, then you actually start to look for some opportunities which you can which you can which you can do. So what was a recruitment like? What did you actually have? You just said you obviously got your crest form signed, which is required for any training. It's not just for surgery. You have to
Right.
do that. Then we also talk about this rule, that 18 months rule, that you need to
Mm.
have less than 18-month experience by the time you are starting your core surgical training to be eligible to apply for core surgical. If you have more than 18 months, then they will expect you to then pass MRCS and then go down the route of ST training.
Yeah.
So these two we know about, the 18-month rule and then the crest form.
Yeah.
And what was it like? So you filled the application on like
Oriel.
online, Oriel,
Yeah.
yeah.
Yeah. So I filled the application on Oriel, and there weren't much of the details that we needed to fill as a surgical training. So there were only employments that I had worked before, my current employment, my past employments that I had worked for the last 3 years, and references. And then there was a criteria where I had to self-assess myself in each of the boxes or each of the headings in the self-assessment form. And the only two things which I did not have at that moment was any higher or intercalated degree, which the UK graduates mostly have when they apply for surgical training, and no higher degrees in medical education or any educational courses like PG diploma or such like that. Those were the only two where I was lacking. Rest all, I made sure that I had full marks on my portfolio. As I said, I was very fortunate, to be honest, because I had a lot of things from back home, so it was not a quite of a burden. But looking back, I would say that it is not that difficult, as people always say that surgery is very difficult to get into. If we plan in a very oriented way, very systematic way, we know what things and who to approach in the right moment, I think it is very doable.
Okay. And then after you filled those self-assessment, obviously your application was submitted. So how did they, and then they check your score against your evidence. Did they ask for evidence then after that?
So when I did my self-assessment scoring, after a few days, they did ask to upload all of the details by the end of, I think it was December, around 9th or 10th. 4th was the last day to upload all the evidences. So there were various ways you can upload the evidences. Either you can just upload the certificates. The total number of entries were 100, that you can upload 100 number of pages or 100 number of PDFs. But what I did was I wanted to make it very concise. Made sure that the whosoever is assessing me knows that I'm pretty organized. So I made all of them combined in one PDF. All my certificates, for example, if there was a commitment to surgery or surgical specialty, I combined all of those certificates in one PDF, made sure I have an index so that they can go through. And I also wrote on the top that this is the number of courses I've attended, and this is the self-assessment marks I'm giving to myself. That made it pretty well. So I only had to upload maybe 11 or 12 PDFs. And based on that, and in the national recruitment, I think this year the cutoff was only 38. Last year cutoff was 47. So I made sure that this time I'm scoring at least more than 50 to be on a safer side, because we never know when the cutoff goes higher.
So after that, was there a interview or any recruitment process?
Yeah. So once we knew that I had crossed the cutoff, I knew that they are going to send me an interview link. Then it was an interview which was conducted. Of course, it was not a face-to-face interview, so I would say it was a little easier, I would say.
Yeah.
Because if it was, so there was one station which was not included in the online version, which is a portfolio section. But when there is a face-to-face, there's always a portfolio section involved. So here we had only two sections involved. If you would like to talk in detail, would you want me to talk in detail about
Yeah,
that?
I think some information around that. What was the experience? I think would be good.
Right. So there was two different station, 10 minutes each. One was the management station, another was clinical scenario. Management station was divided into two different parts again. The first 5 minutes was a presentation. The topic was given beforehand from the interview, and the other part was one ethical scenarios. In the clinical scenario, there were two different scenarios. One more specifically was an ATLS protocol, the way you have to proceed, and another one was an unwell patient, always an ABCDE protocol.
Okay. And were they given to you in advance, all of these, or was
No,
it
no. The presentation section was only those topic was given beforehand, and I think the topic when we received, And when I inquired with my senior members and stuff, they had said me that this is one of the topic which has been repeated for the last 4 or 5 years. It was around leadership and what is your experience around leadership and how you are going to use it in your core surgical training. I think this topic has not changed since last 3 or 4 years.
Okay, and how was your experience? So this is only 10 minutes to two stations.
Yeah.
So they're very quick to go. So you have
Yeah. It was actually pretty quick because the presentation section was only 3 minutes. And for me to sum up in everything in 3 minutes was a real challenge. I had a lot of things which were popping in my head and I had to cut short. I made 17 edits to my speech to make it finalized, to make sure that it cut short into 3 minutes. And then they followed for 2 minutes, they followed questions based on whatever you had spoken or follow-up questions. And as soon as the 5 minutes are up, there was a member of the team who would say 5 minutes up. And even if you are saying, they stop you and they move on to the next question. The next question was an ethical scenario. They give you a scenario, you speak for whatever minutes you want to. Then there are follow-up questions as the time allows. Once the 5 minute is up, you are done. And then they move on to the clinical scenario. Same clinical scenarios, 5 minutes each, 2 scenarios.
And they'll independently mark you. So you have two examiners in front of you.
Yeah, 2 examiners.
Okay. So at the end, then obviously you will get all the scores. So those scores will combine with with your self-assessments as well.
Yeah. So everything counts for 1/3 of the marks. The self-assessment score is 1/3. The ethical or the management station is for 1/3, and the clinical scenarios is for 1/3. So I knew that even if I'm scoring very high in the portfolio section, whosoever is below me or whosoever is higher than my score, it's not going to matter much because it's going to be divided by 1/3. So the actual marks will be only 1 mark or 2 marks difference, not much. So I knew that the interview is the most important part, because that's one thing where you can show and you can differentiate between yourself and the other candidates. Although I felt that I could have done much better in the interview, but I'm happy with what I got.
No, I think congratulations for securing that and going through all this process, because it is, the competition is high on surgery, no doubt. And if we just, for the benefit of IMGs, we're looking at this. If we can tell them a bit about the timeline, because you did mention some dates there. So the next round, I mean, we are recording this in April of 2022. The next round of application will open, I think they advertise around September, and then they start taking application from October onwards. Is that right?
So this year there was a delay in the application. So the application came in around 4th of November.
Yeah.
And last day to get everything sorted out was 30th of November. And to upload the evidences was 4th of December. But usually they give the notification in September, and application starts either by end of October or by the first week of November for sure. The deadline to do everything and get the evidence signed should be 30th of November. So if you do anything after that, and if it is dated after 30th, it won't be counted as
it won't be counted. Yeah.
And
then your interview were in February, March, January.
So the interview was conducted in the month of February, from February 7th till February 18th. You had to choose the slot. And yeah, every day there were many number of slots to be chosen from.
Okay. So, but as you said, you first need to score high enough on the self-scoring, and then the evidence to actually get to the interview stage. So the other thing to clarify, MSRA is not part of surgical training. Is that right?
Yeah, it's not a part of surgical training.
So it's part of psychiatry and sort of GP, but not for
not for core surgical. Yeah, I would say it's not for core surgical training, but there are few. I don't know, in the UK they are not regarded. There are, like, for example, ophthalmology is not regarded as a surgical branch. But if you want to go into ophthalmology, then you'll have to go through MSRA. If you want neurosurgery, you'll have to go through MSRA. And if you want cardiothoracic, it's a completely different
pathway.
It's a completely different. It doesn't go through MSRA. It doesn't go through core surgical training. It's a completely different altogether.
Okay, so I mean, because you have gone through this process, I think you are in a very good position to advise the junior doctors or the medical students who are really keen and interested in surgery, and they're looking at UK or thinking about UK. What would be your advice to them? What should they be doing if they're, for example, if they're already in their home country? What can they do to improve their chances of getting this through?
Right. Um, so there are actually, quite a lot of advices, honestly, but I would categorize them first so that it's easier for them to understand. First, for medical students who are aiming to come to UK and they're very definitive that they want surgical branch, I would ask them to download the self-assessment form, see what they have got till now, and try to achieve a lot of things back home before they come to the UK, so that even if they have only 1 year of experience, they don't find it difficult and they don't struggle for many years to get into core surgical training. If you're already a doctor and you're already in the process of coming to the UK, that means you have passed PLAB 1 or you're about to give PLAB 1 or about to give PLAB 2, and you're very keen on surgery, you know where you want to go. For them, I would say that after your PLAB 1 or after your PLAB 2, the small amount of time that you have, if you're already working back home, then try to do some audits, try to do some poster presentation, which is very simple and very easy. Try to gain some teaching experience, and so that you can have some evidence before you come, so that you have at least some number of marks in each section. You can always build up those marks when you're working here as a non-trainee doctor. For people who are already in UK, who have already started their work in the non-training job and they're very keen in surgical training, I feel 1 year, if you're very keen on it, 1 year is more than sufficient to achieve all the targets. Few of the examples that I would give how to achieve is, if you are looking for a case presentation, look for something unique. For the same case presentation, go for writing an article, go for poster presentation, and when you're doing a poster presentation, aim for a prize. So with one simple case report which is unique to you, which I'm very sure you guys would find it out in your particular job that you're doing, make sure that with one case report you get 3 different criterias. Even if you don't achieve a prize, that's all right, but you have still targeted 2 important things. Management is something which all of us struggle, how to get marks in management. It wasn't difficult for me because I was a part of a surgical society where I was a education lead. But there are many societies in the country where you can always look for and be a part of. You don't have to be a very big contributing member. Whatever small role that you get, you should opt it, get a certificate, be in the position for at least 6 months, get a certificate, at least you get a national second highest points in management. It's very doable. The other thing is audit. A lot of people want to do some bigger audits. I understand the importance of doing a bigger audit, but for the purpose of core surgical training, I always focus on small audit, getting it done within a month's time, 2 cycles, complete cycles, doing in multiple discipline, and getting it out done from my way. If I have to do some bigger audits, you always have a chance to do after you have done the primary reason of a core surgical training. You can always get on more stuffs to be done.
Thank you for this. I think is very useful advice. I think some of the things you said, I would say reinforce them. See, audit when the junior doctors, when you are new IMGs, you can get a lot of ideas, or people can tell you a lot of ideas. And if you take up a very big audit, and I've seen people doing that, they will take up a big audit and they won't know in the middle of it what to do. They might get stuck on some part and then not be able to finish it because it will be too big for them to complete on it, or they need some supervision which they're not able to get. So it's always good to actually find a supervisor, somebody who can actually help you, and find a simple audit which is time bound, and you're going to finish this in
Right.
15
Yeah.
days, 20 days, a month. And most of the audits, for a simpler audit, month is more than enough, to be honest, as you said.
Yeah.
And then bringing out those recommendations, what you found, and then uh, implementation of that, and then doing a re-audit. So in 3 months time you should be able to complete 2 cycles and get those marks. The other thing you mentioned, which is very important, I think, and I also encourage, and it's not just about surgery, in psychiatry, in medicine, other thing about poster presentation. And they look, again, if you are IMG, if you haven't done one, they look overwhelming to present a poster in an international congress or a conference in UK. But it's actually pretty easy, and when you submit them, then you realize they are accepting pretty much everything. I shouldn't say everything. They obviously look. They have some standards, but what sometimes we overestimate them. We think they are
Yeah.
looking for some amazing things, and whatever I have done is maybe not enough. But don't make those assumptions. And poster presentation could be, as you mentioned, for a case series. It could be an interesting case, and also it could be when you're doing audits or quality improvement stuff, they can also become posters and go into conferences. And if you've done any research, they will also become posters and go into conferences. So I think it's, as you said, it's very important to be aware of these things, and you can start doing that. I always encourage now people to start thinking about poster presentations right from their medical school, because this is what British graduates are doing. Their first posters, if you ask them, will be from third year, fourth year, something like that, something of that sort they have done around that time. Shawn, thank you very much for taking time and giving us all your advice. And I'm sure the junior IMGs who are actually looking at surgery will get some encouragement, looking at you, because it is always important to find role models. And you think you are a very good role model for them to see that, as a young doctor, you have uh, gone through the process and secure core surgical training. And I must say that, I know you for some time, and I've seen you. You are very, very organized, and you're more organized than an average doctor, and which actually helps. The things you have mentioned, making an index, and when you're uploading the evidence, making your CV, putting, finding opportunities to improve your CV. A lot of these things take some degree of organization, and I'd like to say to uh, our junior doctor, they need to follow examples like yourself, to actually that if you follow those, if you are that organized, and if you are able to do those things in time, in a good way, you will be able to get your specialty course surgical training if that's what you're aiming for.
Yeah. Thank you so much. I would say that I always had help throughout, because I never stopped looking for help. If I'm not finding help from one place, I always made sure that I'm looking help from somewhere else. You should not consider that you're asking help from somebody, but you should know that you are asking help for yourself. So you should never be shy of asking help from anyone. That being said, I believe that although it's a tick box series from entering into a core surgical training and a self-assessment form, but it is very much doable. As an IMG, I can understand how much amount of struggles we go through, and a lot of things are not possible back home. I also do realize that, but it is well within our limits to get it done in a year's time. If you are still in the UK and doing a non-training job, it's not difficult. We just have to be pretty organized. We need to know who to approach, what needs to be done, and where it needs to be done. And even if you don't know, don't be shy of asking for help. There are a lot of helps available in the IMGs of the UK group, that we all are in, I suppose. And you should always ask your seniors. There are a lot of people who are in the core surgical training. I am an education lead of one of the surgical societies of international doctors. You can always reach out to us for help. We have already conducted a series of educational series under surgery, what to expect as a junior doctor, how to make a portfolio, what else you can do. So you should always look out for help. There is enough help available, and nothing is small. If you are very much committed to what you want to do, I think it's pretty much achievable within the time limit.
One thing I think I would like to ask again, I'm sorry, I've missed that earlier, but people who come here, they always ask this question: should we directly apply for training, or should we actually come and do a non-training post first? And my advice have been on to them that it's better to start with non-training post, because then you can learn a lot of things, and that gives you, as you said, an advantage of building your CV. So non-training posts don't have to be need to be forever. It should normally, most IMGs do it for 12 months, 18 months, and then they're able to enter the next recruitment round. So, which in terms of surgery, would you say the same, that this is if somebody's saying that can I not do all of these things at my home country and then directly apply for surgical training? Is that also doable?
Of course, it's doable. The question is it safe to do, or the question is, would I recommend to do it? So I've got a lot of questions on my Insta handle and on Facebook that I have achieved a lot of these. I have almost 50, 60 marks on my self-assessment form. Can I not directly apply for core surgical training? My personal advice is I would suggest no. You need to be here in the UK to understand how it works. Now, the counter question when I say this, people ask me that, can I not just do clinical attachment and understand the NHS and then straightforward apply? The answer to that is again a no, because in clinical attachment, you don't really have the pressure. You don't really have any job to be done by yourself. You are understanding the system, but the pressure is something that you will only understand when you are in a job. On calls here is very different than on calls back home. Even if I'm doing a night shift back home, I'm mostly ward based. Here, when I'm on call, I'm actually seeing people in ED and admitting them. Two very different scenarios from back home and in UK. In terms of surgical training, I would say it's always good to start as a non-training, understand the system, understand how difficult it is to transit from home country to NHS. Once you are very comfortable with it, you have a lot of opportunities here to build your portfolio. And once you understand the system, it becomes so much easier to transition to become, to transition into a surgical training or any training for that matter. Because one thing I would definitely say is when you transit from a non-training job or directly from your home country to a training job, there is certain amount of requirement, I would say, or a certain amount of expectations that people are needing from you when you join a training. And sometimes when you don't fulfill that part, you get overwhelmed. You feel that you are not cut out to be a doctor or not cut out to be a training at that moment. I would ask not to experience all those things when you join. So once you feel very comfortable as a non-trainee, transition becoming so easy, and the expectations that they are expecting, you have already done it in your previous job. So it won't be overwhelming for you when you're into a training, because they scrutinize very, very carefully in training.
Yeah, I think that's a very good advice, and I have seen people struggling to who directly enter training, and in other specialties as well. And as you mentioned that there are some certain obligations as a trainee. One of them is to actually do some workplace-based assessments, maintain a portfolio, get a supervisor's report every 6 months. So all of this, when this is all going on, when you have expectation, time is running out, and if you're still understanding the system, and you're at a stage when you're thinking, actually, let me first understand what's going on, and then I'll start doing the assessment. Then then you'll take a few months to just understand, and all of these requests will be coming to you where, what have you done about your assessment, why is your portfolio still empty, and you'll be like, I don't know how to fill this portfolio yet. So I
Yeah.
think that if, and by going through that, a lot of people get overwhelmed, and then sometimes their training program directors or their clinical supervisors or education supervisors say to them, you need some additional time, maybe you need an extra 6 months. And that can be a very negative thing. The doctors might take it to their heart, thinking that, they're saying to me that I'm not good enough. Although they're not saying that to you, that you're not good enough. They're just saying you need more time to understand the system, to
Yeah.
get to the pace with it.
Yeah.
But it could be a very big setback emotionally for somebody to actually being told that I can't give you a good report yet, but you need some extra time. You need 3 more months. You need 6 more months. So I think that can become a problem. The other thing I think I forgot to ask about the MRCS exam, because a lot of people ask that, should I start doing MRCS now if I'm going for surgery, or should I wait for to enter the training? Are there any marks for MRCS one as well in when you're applying?
Yes. So the portfolio this year changed a lot. And that was one of the reasons why I had to hustle a lot in between November 4th and November 30th. So there was no marks for conferences earlier. The number of surgeries that you had to do increased from 15 plus to 39 plus for the highest marks. So a lot of changes did happen this year. One of those changes was earlier they used to give 1 marks for people those who have booked PLAB, MRCS course in advance for the month of January. But this year they had cut off, they removed that part, and they are like only those who have given the exam and have passed are going to get full marks. Then the full marks are 4 points. Now,
This is the part one only, not the full
part,
exam.
or just the part one,
Yeah.
MRCS part one. Although I would suggest that it is always good to give MRCS Part A if you know that you're going into surgical training. But I would say it's not a mandatory thing. You can always do it later, provided that you know that you will be able to do both Part A and Part B in 2 years' time.
The other thing you mentioned about the number of surgeries, is it you need to keep a logbook as a
Oh,
um,
yeah. Yeah. So if I have to talk about this, so there is an online website called e-surgical logbook, e-logbook, and you can always clock in your surgeries that you are a part of. You don't need to do surgeries by yourself. It's not an individual surgery, but if you're a part of a surgery, you can do that. I ensured that I'm having 40 plus in the UK, but I also added the surgeries that I did back home. So I'm not sure if they did count or if they did not count. But if you have surgeries from back home, do please put it. Please clock in, add the hospital into the list, do clock in all the surgeries that you have done back home and try to achieve at least 30 plus surgeries or 30 to 39 surgeries in the UK if you are into a surgical training. Even if you're not working as a surgery, for example, I was not in surgery in my first job that I was doing in the UK, but I still did, I used to go to theaters. I used to tell to the senior colleagues, the registrars and the consultants that I'm applying for core surgical training this year. Would you be happy for me to be a part of the surgical team today? And they used to happily allow me. They never said no. Nobody told me no. So whenever I had the off or whenever I had some time, I used to always go and be a part of the surgery so that I can clock in. Once I clocked in, I went to that consultant and asked him to sign off all the surgeries that I was a part of under his department.
So I was going to ask you, how do you get it confirmed? Do you have to physically sign it, or is it like online signature?
No, they have to physically sign it. They have to sign it. If you are getting it from back home, you have to sign. They have to write their name, their registration number of the country, the date they are signing in, and also the stamp if available. That would be
Okay.
the ideal scenario from back home. In the UK, you only need the name, the GMC number, the date, and the signature.
Okay. No, no, that's fine. No, thank you very much for all your advice and all the tips you have given. And I'm sure a lot of IMGs will find this useful and will try and take this path as well.
Yeah, I'm really glad that I'm always able to help people, and I'm very glad that I can do that. Um, I'm more than happy to help people around. Thank you so
Thank
much
you.
for
Thank
having
you.
me.